So why is this a problem? A lack of access to healthy foods can have a domino effect and can influence many aspects of life. A growing number of children in the United States, 1 in 3 between the ages of 2 and 19, according to a peer-reviewed studies collected by the White House's Task Force on Childhood Obesity, are overweight or obese. Overweight children may experience higher rates of heart disease, diabetes, and other chronic conditions, as adults must bear the costs of treating them. Food access is about more than just whether there are grocery stores in a community. It also has to do with whether households can afford to purchase food, and affordability is closely related to rates of employment and job quality.
A clear issue related to the healthy food crisis is the prevalence of food deserts. Food deserts are defined by the USDA as low-income tracts in which a substantial number or proportion of the population has low access to supermarkets or large grocery stores. According to Johns Hopkins University, in general, food deserts tend to target low-income minority neighborhoods. This issue is exacerbated by the lack of transportation available in the deserts. Without a way to quickly reach stores with healthy food options, for many people, a store even a mile away becomes too far to access, especially in rural communities. These three culminate into an overall American crisis, leaving many families and children in poor health conditions.
Detroit, Michigan is a low-income region as their unemployment rate sits at almost 30% in 2020, which is also predominantly people of color, which leads to residents being unable to afford healthy food options or the transportation to travel to grocery stores. Residents may also be working class and they do not have the time to prepare healthy meals. This makes fast food or corner store food to become more convenient for these families. Detroit, Michigan should focus on their low-income, predominantly people of color communities with a lack of transportation access for healthy food options.
Our first solution is a local food pantry. These pantries will help lower income community, specifically families in certain areas, locate healthy and free food. Our second solution are mobile food markets. Many people who have more opportunities at having access to healthy food, they could donate to lower income communities, as well as a mobile food market to help reduce the distance between food and the individuals in the community. Our last downstream solution is a local food garden. Making these gardens more accessible, community members will provide a variety of food and will provide quality food to nearby community members.
Health in All Policies is an approach that integrates health considerations into policymaking across sectors to improve the health of all communities and people. It was created to address the social determinants of health, which include access to education, housing, transportation, and safety. The different principles of health in all policies can be applied to different solutions to help us better understand how to solve the problem. These principles include relationships, informational resources, personnel resources, funding resources, and legal resources. It is important that we acknowledge these principles when making up solutions to lack of transportation, because we will have to create new laws and policies in order to create change.
One upstream solution to the lack of access to healthy food due to transportation would be for cities to form contracts with local grocery stores, creating a policy to open a store within a 10-mile radius near schools, universities, and most importantly, food deserts. While more than 23 million Americans are living in food deserts with no access to transportation, this solution would help in every aspect of health. Michigan alone has over 250 farmers markets, but those are in much more poor and rural areas that still lack the resources and requirements to sell varieties of fresh fruit, vegetables, dairy products, and meat. College students are now relying on fast food chains on campus rather than healthier options because of the inconvenience. If grocery stores were nearby campus, students who do not have vehicles would still be able to walk there and even become more motivated to cook their own meals and eat healthier. The second upstream solution relating to the lack of transportation would be to create a policy regulating numerous bus and shuttle routes on a daily basis commuting to a grocery store and healthy food destinations for members of the community. The bus system should be made offering many travel times throughout the week to best accommodate for the people living there. A great example of this would be Austin, Texas's grocery bus. This bus line starts off in a low-income Latino community lacking sufficient resources of food and travels to areas with healthier food options. This is a great model created by the Sustainable Food Center in 1996. This representation of an upstream solution would make a tremendous difference in the city of Detroit and help the community grow. As an argument of money, taxes may be given as the payment of the bus and shuttle expenses if it is difficult to implement the solutions. Since we are focusing on Detroit, Michigan, this city could possibly have a voting system to see in which who is for the process and who thinks it is an unnecessary project. This would be very beneficial to all the people of the community and stay on a very flexible basis to satisfy the needs of all people.
Some of the difficulties that may arise when implementing the solutions suggested are difficulty finding good land and enough space for the community food gardens, trouble finding or raising funds for the new shuttle routes, and motivating locals to use the implementations and make them a part of their everyday lives.
Measuring the implications is important in seeing if the solutions were effective. For transportation, a measuring solution would be mailing surveys to residents in a 10-mile radius of the new transportation. The survey would ask if they use the transportation to go to the grocery store, and if so, how often, do they like it, do they want this in this community, and this will show if it's successful or not. For new grocery stores, a measuring solution would be for the city to check the new grocery store's revenue to see, and if the revenue is steady, then that's successful because they're going and shopping there.